Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune. Today I'm going to tell you a little bit about pituitary tumors. These are more common than you would think, and a lot of patients have tiny little growths in their pituitaries without even knowing about it. So the pituitary is basically a tiny little organ. It's the size of a pea and it's present right in the center of your brain. The role of this organ is actually to control the entire hormonal apparatus in your body. It controls the level of almost all the hormones in your body, despite being such a small little thing. It modulates the levels of things like thyroids, your steroid hormones, your fertility hormones, controls almost all of them. And its functions include things like regulating your growth, your metabolic rate, your fertility, your mood, your libido. It controls all these things. So it's a really important thing. It's present right inside your brain, and any problem with this organ can have effects on the rest of your body. What is a pituitary tumor? A tumor in medical terms is basically a growth or a swelling. A tumor does not mean cancer, and a pituitary tumor is basically a growth or a swelling inside the pituitary gland. Most of these are not malignant cancers. By malignant we mean cancers that spread to the rest of the body and usually have a very bad prognosis. Most pituitary tumors are benign. They're just growths. They just stay there. They do affect the functioning of the pituitary gland. They will disturb your hormonal balance, and they could also have other effects just because of their size. But one of the important things to remember is that pituitary tumors are usually not malignant. They are not going to spread very fast to other parts of your body, so you don't need to panic. The next thing is they may be caused purely by chance. They often don't have any reason because of which they are caused. Sometimes they are because of genetic mutations, but usually the cause in pituitary tumors is not even the most important thing. What doctors would try to do is find out its size, what it's affecting, and then treat that. What are some signs that you would experience if you have a pituitary tumor? Well, like I told you, it's a swelling inside the brain, and because the brain is a place where there are a lot of these nerves and all kinds of tracts and neurons all very closely approximated to each other. If there's a swelling in any one part, it begins to press down on everything else. And so usually people who have pituitary tumors, they usually begin to have problems with their eyesight. That's because the nerves that carry your eyesight back to your brain, they start getting pressed upon by this growth of the pituitary. And so you will probably start complaining of things like not being able to see on one side, or having half your vision you can see, the other half you can't see. You develop these kinds of problems, or you may find that you have double vision. So visual problems as well as headaches, these are sometimes the first complaints in people who have pituitary tumors. Other than this, we have the effects of the malfunctioning of the pituitary gland itself. Now these are all related to your hormones, so you might show up with problems like changes in your weight, changes in your mood, changes in your libido. You might find that you're not able to conceive. There are problems with your fertility. There's swelling all over your body is retaining too much water, you're feeling thirsty all the time, or you want to urinate all the time. All these are signs of derangements of the hormones in your body, and that is because the pituitary controls all the hormones. So these are some of the symptoms that we see in people with with pituitary tumors.